Hello friends, today we are going to discuss about dialysis. What do you know about it? Gratitude is a dialysis of sorts. It flushes the self-pity out of your system. Max Lucado. I am Dr. Jagatjit Singh Virk, presenting to you this session. Dialysis. In medicine, dialysis is the process of removing excess water, solids, and toxins from the blood. In people whose kidneys can no longer perform these functions naturally. This is called renal replacement therapy. The first successful dialysis was performed in 1943. What are the three types of dialysis? There are three main types of dialysis: in-center hemodialysis, home hemodialysis, and peritoneal dialysis. Each type has pros and cons. It's important to remember that even once you choose a type of dialysis, you always have the option to change, so you don't have to feel logged in to any one type of dialysis. Is dialysis very painful? Myth. Myth is dialysis is painful. But the fact is, if you are on the hemodialysis, you may have some discomfort when the needles are put into your fistula or graft. But most patients usually have no other problems. The dialysis treatment itself is painless. How long you can live on dialysis? Average life expectancy on dialysis is 5 to 10 years. However, many patients have lived well on dialysis for 20 or even 30 years. Talk to your healthcare team about how to take care of yourself and stay healthy on dialysis. Can kidney start working again? The good news is that acute kidney failure can often be reversed. The kidneys usually start working again within several weeks to months after the underlying cause has been treated. Dialysis is needed until then. What are the side effects of dialysis? The most common side effects of hemodialysis include low blood pressure, excess site infection, muscle cramps, itchy skin, and blood clots. The most common side effects of peritoneal dialysis include peritonitis, hernia, blood sugar changes, potassium imbalances, and weight gain. Is dialysis permanent or temporary? While kidney failure is often permanent, beginning as chronic kidney disease and progressing to end-stage kidney disease, it can be temporary. If one experiences acute kidney failure, dialysis is only necessary until the body responds to treatment and the kidneys are repaired. In these cases, dialysis is temporary. Why dialysis is done for 4 hours? Enlarging the vein makes it possible to insert the catheters. Hemodialysis is usually done 3 times a week for 3 to 4 hours a day, depending upon how well the kidneys work and how much fluid weight they have gained between treatments. How long is recovery after dialysis? Recovery rates range between 10% and 15% within the first 30 days of dialysis initiation. But nearly half of patients who recovered kidney function did so within 90 days after dialysis initiation. Few patients recovered after 180 days of outpatient chronic dialysis. Does dialysis last forever? Most people can remain on dialysis for many years, although the treatment can only partially compensate for the loss of kidney function. Having kidneys that do not work properly can place a significant strain on the body. What happens if you don't get dialysis? If you don't have dialysis, your kidneys will continue to fail and you will eventually die. How long you could live depends on your overall health aside from your kidney disease and how much kidney function you have left. As death nears, you will start to feel sleepy and weak. What are the signs of dying from kidney failure? Some of the most common end-of-life kidney failure signs include water retention, swelling of legs and feet, loss of appetite, nausea, vomiting, confusion, shortness of breath, insomnia and sleep issues, itchiness, cramps and muscle twitches, passing very little or no urine, drowsiness and fatigue. Can dialysis be cured? Does dialysis cure kidney failure? No. Even when very well done, dialysis only replaces part of your kidney function. Hemodialysis and peritoneal dialysis allow people with kidney failure to feel better and continue doing the things they enjoy, but neither replaces all of the jobs that healthy kidneys do. What are the signs that you need dialysis? Kidney failure symptoms from buildup of wastes in the body, a metallic taste in the mouth or ammonia breath, protein aversion, no longer wanting to eat meat, nausea and vomiting, difficulty concentrating, loss of appetite, itchiness, pruritus. All these symptoms. Why do dialysis patients turn dark? Many reported cases of discolored skin or hyperpigmentation happen to people with end-stage renal disease. One cause of skin discoloration is related to pigments called urochromes being retained in the skin. Normally, these are excreted by healthy kidneys. Patients with this condition tend to have a grayish, almost metallic color skin. How do you feel after first dialysis? Fatigue, where you feel tired and exhausted all the time, is a common side effect in people who use either form of dialysis on a long-term basis. Fatigue is thought to be caused by a combination of the loss of normal kidney function, the effects dialysis can have on the body. Do dialysis patients smell? Is it normal if the patient on dialysis has an ammonia odor to their person? Yes. This is very common and more noticeable just prior to dialysis sessions. It is less noticeable after dialysis sessions. Why do dialysis patients smell like urine? When the excess urea in your body reacts with saliva, it forms ammonia, which you then exhale through your breath. If you have chronic kidney disease, this is what gives you breath, that ammonia scent. The medical name for this is uremic fetor. How do doctors flush your kidneys? How does hemodialysis work? Hemodialysis is a procedure where a dialysis machine and a special filter called an artificial kidney or a dialyzer are used to clean your blood. To get your blood into the dialysis, the doctor needs to make an access or entrance into your blood vessels. Does dialysis clean your blood? Dialysis cleans your blood by passing it through a filter. If you do peritoneal dialysis, the filter is the lining of your abdomen, your peritoneum. If you do hemodialysis, the filter is made of plastic. Your blood is on one side of the filter. What is the longest someone lived on dialysis? Mahesh Mehta in the UK holds the Guinness World Record for the longest time on dialysis at 43 years and counting. Now 61. Mehta started treatment at age 18 and 2 transplants failed. He did home dialysis before and after the surgeries. Can you survive on dialysis without kidney? Yes, but kidney dialysis would be needed. We occasionally remove both kidneys prior to transplantation in certain kidney diseases, but dialysis is necessary until the transplant occurs. Who is not a candidate for dialysis? Dialysis may not be the best option for everyone with kidney failure. Several European studies have shown that dialysis does not guarantee a survival benefit for people over age 75 who have medical problems like dementia or ischemic heart disease, in addition to end-stage kidney disease. Is dialysis hard on heart? Dialysis treatments do not affect the heart health of kidney disease patients who have had a heart attack, according to a new study. Since cardiovascular disease is the most common cause of death in kidney disease patients, the findings are good news for individuals who need the treatments. Do dialysis patients sleep a lot? Sleep-associated symptoms and excessive daytime sleepiness are felt to be more common in dialysis patients. Several surveys conducted in this patient population have identified a prevalence of sleep disturbances in up to 80% of the patients. How much water a dialysis patient drink? Most dialysis patients need to limit their fluid intake to 32 ounces per day. Manage your thirst. Your dietitian can help you find ways to manage your thirst, such as sugar-free hard candies, ice chips, or frozen grapes. This will help you avoid drinking too much fluid between dialysis treatments. What can I expect at my first dialysis treatment? During your first sessions, you may have some nausea, cramping, dizziness, and headaches. This may go away after a few sessions. But be sure to tell your providers if you feel unwell. Your providers may be able to adjust your treatment to help you feel more comfortable. This is all. Thank you very much.